just for some introduction, my name is Eric. I'm one of the pharmacy students at Mint Health and Drugs CMP, and I will be your presenter this afternoon. Also in attendance is our pharmacy owner slash manager, Choi, and he's here just to oversee the training session. Just to go over the format of these training sessions, first we'll just go through the presentation together, and afterwards there'll be a quiz that each of you will be completing. There is a link to the quiz at the end of the presentation, and then you'll have some time dedicated to complete that. And we'll just first start off with the Naloxone training. So to start off, I just wanted to speak a little bit about harm reduction. So essentially what harm reduction is a practice or an act that is aimed towards reducing harm from substance abuse. And to practice harm reduction, it is important to educate those who are at risk of overdosing to have them avoid mixing any substances such as opioids mixed with alcohol or benzodiazepine. Another way to practice harm reduction is to educate them on to test a small sample of whatever substance they want to use first. Another way is to always advise them to never use by themselves, just in case if anything happens to them, someone is with them to notify the appropriate emergency personnel. We also want to encourage safer routes of using, such as ingesting or even snorting, as opposed to injecting. And lastly is just to educate them on the signs and symptoms of overdosing, which we will touch on later. Now, let's talk a little bit about naloxone. So basically, naloxone is a medication, and the way it works is that it prevents or reverses the effects of opioids, opioids such as codeine, morphine, hydromorphone, or oxycodone. Some other illicit substances that you may have heard that are classified as opioids could be heroin or fentanyl. I just want to stress the fact that with naloxone, even though it prevents or reverses the effects of opioids, this effect is actually just temporary. Now, who is at risk of opioid overdoses? Individuals who have a history of overdoses, previous self-harm attempts, or people who had previous suicide attempts in the past. Others who are at risk are people who are using opioids off the street, as well as using opioids that are prescribed by their doctor. Others are recovering users, and what this means is that individuals who have been recently hospitalized, who are undergoing or have undergone abstinence, or are using opioid substitution programs. Common ones that come to mind are Suboxone or methadone, and even those who have been recently incarcerated. Others who are at risk are people who mix opioids with other drugs, like the ones mentioned earlier, alcohol or benzodiazepine, and those who inject opioids intravenously. Some common questions about naloxone is that, can naloxone be abused? So basically, the short answer is no, it cannot be abused. Basically, without the presence of opioids in the individual's body, naloxone will have no effect. And another question is, are there side effects with naloxone? So basically, the effects felt from naloxone comes from how it works. So basically, once it removes the opioid from the body, you may experience some withdrawal symptoms, such as being alert, disoriented, angry, or even agitated. And who should not use naloxone? Basically, the only contraindication to naloxone is in patients with a known allergy to it, and severe allergy at that. But generally, naloxone overall is very safe. So illicit substances are usually classified in two broad categories, and we'll go through the differences now. So the first category is depressants, also known as downers. And examples of these are opioids, alcohol, sedatives. And what they do is that they can cause effects such as euphoria. They can decrease heart rate. They can also decrease breathing. They can also cause the individual to become drowsy. Their speech can be slurred, and their pupils will constrict. They also may lose consciousness. On the other hand, we have stimulants, also known as uppers, and some examples of these are cocaine, crystal meth, MDMA. And what these do is basically the opposite of what downers do. So they'll increase heart rate. You may have a racing pulse. You may have shortness of breath because you're breathing so frequently. Your body temperature may increase. You may have some sweating and maybe even some seizures. With the stimulants, you can still overdose on these substances, and the symptoms of a stimulant overdose is tremors, confusion, hostility, hallucination, panic, skin flushing, which is when your skin becomes red with all of the increased blood flow, palpitation, which is feeling your heartbeat, seizures, and even chest pain. One thing I want to note is that with naloxone, naloxone is only used for opioid overdoses, so it won't be effective in using it for stimulant overdoses. Stimulant overdoses are still considered a medical emergency, so still notify 911. If you come across somebody who is actively having a stimulant overdose, there are some things that you can do to help them. Some things is just to try to protect them from injury, which can be just removing harmful or hazardous materials around them. It's very important not to try to restrain them and just let the episode pass. Also, if required, you can help loosen their clothing. And if they are having trouble breathing, use your fingers or gently clear their mouth from any fluids that may be making them choke. Also call for help. Now switching to opioids. Opioids can be classified into, or symptoms of opioid use can be classified into toxicity or overdose. With toxicity, the individual will still be responsive to stimuli, such as loud noises, a light shake, or a sternal rub. Their pupils will be constricted. Also, their muscles will be droopy. They may also show signs of something called nodding out. And how I like to describe this is, I guess, just imagine yourself in a classroom and you're listening to your instructor speak, and you're really tired. So you're struggling to stay awake and your head is falling forward and you're just trying to stay awake, and that's a continuous motion. That's just how I like to, I guess, describe what nodding out is. And lastly is they'll still have slurred speech. So they are still responsive overall. On the other hand, with overdoses, the individual is not responsive to any stimuli. So no shakes won't wake them up, calling their name, they won't wake up. Also, take a look at their breathing. They may be breathing very slowly or not at all. Their body may become limp. Their fingernails and lips may become blue. Their skin will be cold and clammy. And they may actually be choking or have snore-like gurgling noises. Some other symptoms are they may vomit and they may lose consciousness. So these are some things not to do in cases of opioid overdoses. First thing is do not let them sleep it off. It's very hard to tell whether they are just sleeping or they may fall into something called respiratory depression, which ultimately is they end up stop breathing. Another thing not to do is do not give them amphetamines, even though in the earlier slides, the effects of amphetamines or stimulants are basically the opposite of opioids. They do work on different receptors, so this won't be helpful. Another thing is do not put them in a cold bath or shower, as with rapid changes to their body temperature, they can go into shock or they can even drown from the water. Please do not slap, hit, or punch the individual who's overdosing, as this does not reverse the effects either. And do not induce vomiting, as the individuals can choke. Now, just going into the components of what's inside a naloxone kit. So basically, there are three separate vials, which are for 3 separate doses. There's also 3 syringes that are 3 millimeters in size with a 25 gauge 1-inch needle. Also, it comes with 3 alcohol swabs and a pair of latex gloves. There is a one-way rescue barrier mask, and there's also a instruction pamphlet inside. So in the cases of opioid overdoses, and if you have a naloxone kit handy, one way to remember all of the steps is through the acronym SAVE ME. Just to start off with the S in SAVE ME, S stands for stimulate. So call their name, give them a sternal rub. And if they do not respond or if they are not breathing, call 911 at this point. I guess just to explain what a sternal rub is if you were to imagine closing both fists and putting them together, and then if you were to rotate your palms downwards and using those knuckles to rub up and down the individual's chest, this maneuver is actually quite painful. And if they were not having an opioid overdose, and if they were just very sleepy, this would definitely wake them up. So this is a really good way just to determine if someone is responsive or not. The second acronym, or the second letter in the acronym, A, stands for airway. What you want to do is tilt their chin up and open their airway. At this point, it's also good to examine if there is anything that's blocking their airways in their mouth, whether that is food or maybe they have vomited earlier on. This is a good opportunity to just double check and, if needed, just to remove it for them. V stands for ventilation. If they are not breathing, use the barrier mask, plug their nose, and provide one breath every 5 seconds for 2 minutes. And what this does, it still supplies their body with oxygen just to keep their brain alive. And E stands for evaluate. If there is no response after they rescue breathing, at this point, now is the time to administer the naloxone. Again, I just want to reiterate that naloxone only works with opioid-related overdoses, and typically it kicks in pretty quick, about 2 to 5 minutes. And it is effective up to 30 to 60 minutes. And what this means is after the 30 to 60 minutes, the naloxone would have then cleared out of their body and they can revert back to having an active overdose. This is why it's very important to call 911, even if you suspect it, after they are non-responsive or not breathing. So M in Save Me stands for muscular injection. What you want to do is to remove as much clothing as possible to expose the middle thigh. This first step is very case by case. If you are unable to remove the clothing, that's fine as well. These needles are designed so that they can pierce through even jeans. Also, there are a couple other injection points that you can administer the naloxone. It doesn't have to just be in the upper middle thigh. Some other areas can be the shoulder or the glute muscle. But after you have located an injection site, what you want to do is remove the vial cap, swab the injection site with the alcohol swab, and then insert the needle into the vial. And you want to draw up 1 ml, which should be the entire contents of the vial. Afterwards, what you want to do is just to remove all air bubbles from the syringe. And to do that, you just want to have the needle tip pointing upwards, flick the syringe on the side very carefully, and just watch all the air bubbles move to the tip of the needle, and then push out all the air. And then when you're ready to inject, you want to inject at a 90-degree angle. Push the plunger slowly until it's empty. There should be a click, which acts as a safety mechanism where it withdraws the needle into the syringe just so that it won't poke you or the individual again. You want to remove the syringe in the same angle that it came in, and then make sure you hold on to the syringe and the vial of naloxone. At this point, you want to double check if EMS is on their way, just in case if the patient overdoses again when the naloxone wears off after a half to an hour. And then again, just to keep all of the needles and materials used until EMS arrives, just to show them how many doses were provided. The second E is to evaluate again. After the first dose of naloxone, unless they are awake and breathing, continue with the rescue breathing for another 2 minutes. And just as a reminder, it is 1 breath every 5 seconds. If they are not responsive and breathing after the 2 minutes, now is the time to give the second dose of naloxone, and then just to continue the rescue breathing until help arrives, or if they start breathing on their own. At this point, if they are awake, they may be disoriented or agitated just because of how naloxone works. They may be in a state of withdrawal. And at this point, just explain to the individual that they've experienced a opioid overdose and that help is on their way. Also, just discourage any further opioid use at this time. At this point, you want to stay with the person until help arrives, until the ambulance comes. But if you must go, place them in a recovery position as shown below. This just helps to keep the airways open and to prevent any choking if vomiting occurs. Now, naloxone comes in the injection formulation as well as the nasal spray. With the spray, the same acronym still applies, the save me steps. But with the sprays, there's only 2 doses of naloxone in each box. If the person does not wake up after 2 minutes after applying the first dose, administer the second Narcan spray into the other nostril. Always alternate between each nostril if more doses are needed. And with this device, just because there is only 2 doses in it, avoid testing the device. One thing to note about these Narcan nasal sprays is that they aren't provincially covered and only certain plans cover these, for example, NIHB. To use the Narcan nasal spray, just remember the 3 P. First P stands for peel, and you want to peel back the package and remove the device. And to hold this device, you want to make sure that the thumb is at the bottom of the plunger and your two fingers is on the nozzle. The second P is to place and hold the tip of the nozzle in either nostril and until your fingers touch the bottom of the patient's nose. The last P stands for press, and this is just to administer the dose inside the patient's nose. Again, if a second dose is required, use the other nostril after. And that comes to our conclusion of the naloxone training.